Alright, hi guys, my name's Gabby Gonzalez and I'm going to be talking to you guys about gas gangrene for Dr. Cody's microbiology class. Alright, so just want to start with what gangrene is. Overall, it's just a necrotic disease or condition caused by bacterial infection. There's a couple different types. Dry gangrene is this top left one, characterized by like that dry, scaly looking appearance that happens on the top layer of the skin. Wet gangrene, kind of the opposite. It's where fluid forms at the very surface layers under the epidermis, like dermis area. Not very deep, but still really detrimental. Gas gangrene is going to be this middle picture and is what I'm going to be focusing on today. So it's characterized by these lesions or like blisters filled with gas or fluids. Fournier's gangrene is going to be mainly in the genital area, and I was going to include pictures, but they're really gross and I didn't think any of y'all wanted to see them, so just use your imagination. Internal gangrene is when blood is constricted from organs, causing necrosis, and that's what's kind of going on in that bottom picture. So historical context, 1861, Louis Pasteur identified Clostridium botulinum, which is the first Clostridium species. Significant because Clostridium is the genus that our infectious agent of gas gangrene is under. So that's why that's significant. 1892, Welch and Nuttall isolated the first gas gangrenous agent from a wound, from a gangrenous wound. They identified a gram-positive anaerobic bacillus, and they originally named it Bacillus aerogenes, then reclassified it as Bacillus perfringens, reclassified it again as Clostridium welchi, and then for a final time it was reclassified as Clostridium perfringens, which is what we know it as today. So it gained recognition for its wartime incidents during World War I. Because the soil was so highly cultivated and trench warfare was so popular, open wounds were getting contaminated with the soil. Doctors initially thought to leave the infections alone, but that really only made them worse. So that was why they were so prominent. Its significant incidence was because civilian cases were so rare, but cases within like soldiers and stuff were so prominent. So these are just some quotes from some German soldiers and then from the U.S. Army Medical Department Office of Medical History, just kind of explaining how severe these cases were. So the formal name for gas gangrene is Clostridial myonecrosis. It's also referred to as necrotizing subcutaneous infection. So this is just taxonomy of the agent. It belongs to the bacteria kingdom, and all the way down at the bottom you can see it comes from the Clostridium genus and the species perfringens. So the infectious agent is C. perfringens. It's a gram-positive bacillus. It's anaerobic, spore-forming, non-motile, and saprophytic, which basically means it gets its nutrients from dead plants and animals. So this is why in humans, its like purpose is to necrotize tissues. This way it can get nutrients and it can kind of survive and exist in the body. So strains and pathogenesis, there's 5 identified strains. All are pathogenic, and they're divided based on the toxins they produce. There's A, B, C, D, and E strains. And so the A strain is going to contain the alpha toxin and perfringylicin O, which is another toxin. These two are going to be the most important toxins, and I'll talk about why. So all of these exotoxins are going to be lethal, and most are necrotizing. The alpha toxin, also known as CPA, releases its main enzyme phospholipase C, which is what it uses to cause necrosis and a lot of other detrimental effects to the body. It's the main toxin, and it's a crucial virulence factor because without it, gas gangrene literally it just couldn't occur. It's why it is what it is, and that's why it's so important, because without it, like, nothing would really happen. Perfringylicin O, or PFO, works with this alpha toxin to cause all of these effects. So that's why they're the most prominent ones. They also occur in all of the strains, but I only kind of mention it in the A strain, but they're in all of them, both of them. So together these toxins make white blood cells clump together and clog blood vessels, which is called leukostasis, and this prohibits the white blood cells to reach the site of infection, which is why they're such important virulence factors, because they literally render the immune system helpless. Like, it can't help the body because they can't even get to the site of infection. It also causes vascular leakage, which is basically swelling, and swelling is such a prominent symptom. Just another reason or example of how these toxins are so effective and detrimental. So pathology, like I said, myonecrosis, so muscle tissue death is what that basically means, and that's the main thing that occurs when gas gangrene is contracted. So infection develops deep within the body, and the muscles or the organs, and blood flow to body tissues is compromised. This causes the necrosis of muscle and subcutaneous fat. It kind of renders white blood cells and red blood cells helpless, kind of just not allowing them to do their job. Phospholipids in muscle cells, they're also just kind of like not able to function properly. And this disease commonly affects appendages like arms and legs. It can also affect fingers, toes. It can affect internal organs. Really just occur anywhere on the skin or in the body, and then on the skin too when those lesions and like blisters form. So in this picture, or all the pictures in the x-rays, you can see like the necrosis happening and like the bubbles forming. And then on the other picture, you can just see like the discoloration and the lesions beginning to form. So signs and symptoms occur really rapidly. They've been clocked at 10 centimeters per hour. The incubation period is less than 24 hours. So these symptoms, like you can visually watch them happen as they occur. It's really, really quick. Some of the key ones are changes in skin color from normal to brownish red, purple, or black. There's a lot of swelling and pain around the infected area. Subcutaneous emphysema, which is that bubbling that occurs, and when those like lesions are popped, there's a discharge of a distinctive like sweet smelling amber or brown colored fluid. Really gross. Systemic symptoms are tachycardia, renal failure, sweating, and mental changes like anxiety or stress. General symptoms that occur with most cases are blisters, fever, excessive sweating, increased heart rate, vomiting, and jaundice, which is yellow skin or eyes. Jaundice isn't like an initial symptom. It kind of occurs later on, but it does occur. And delayed treatment can lead to sepsis, septic shock, kidney failure, coma, or even death. And if you don't get like open infections or just infections in general treated as soon as possible, amputations typically occur. So I guess that's kind of a more severe symptom. Oh, and this picture just shows like a clean wound as opposed to a gangrenous wound. There's obvious swelling and infection that's occurred. So transmission, there's no like hand to hand or like touch or airborne transmission. You really only contract this disease like if you have an open wound, or if you're like stuck with a dirty needle, it has to be like physically injected or like contracted by your, like it has to go into the body. There's three categories: post-traumatic, post-operative, and spontaneous, that people classify like contracting the disease, forms of contracting the disease. So post-traumatic is like after a traumatic experience like a car crash. So this is what the majority of infections happen, how the majority of infections happen. Or also accidents involving like agriculture with like soil-covered farms. So post-operative is following a surgery, and most frequently surgeries of the GI and biliary tract, or following septic abortion. So like that picture, if your wound isn't like, or if your stitches aren't like cleaned properly and infection occurs, gangrene can occur as well. So spontaneous is the most lethal type of like contraction, but it's also the most rare, and it's associated with like risk factors such as colorectal adenocarcinoma, hematologic malignancies, or diabetes. Any conditions that really affect blood flow. So diagnosis and treatment, it's pretty easy to spot if you have gangrene or not, but if you come in with like early symptoms, physical examinations and diagnostic tests will like clarify whether you have it or not. Skin tests for the presence of C. perfringens or other bacteria, blood tests for abnormal white blood cell count indicating infection, or imaging tests such as x-rays, MRIs, cardiograms, arteriograms. And then sometimes surgery is used to kind of evaluate the spread within the body. And then for treatment, immediate treatment is required. Like it's crucial that if you even have the slightest inclination you have this, go to the doctor. So following diagnosis, high doses of antibiotics are administered, like penicillin and clindamycin. These are administered at the same time for like the best possible effects. And the removal of dead tissue is critical, preventing the spread of infection, and treating the initial condition that caused the infection to develop. Skin grafts are used to kind of repair skin, damaged skin. Amputations if you have necrotic tissue that just can't be saved. Hyperbaric oxygen treatment with like these hyperbaric oxygen chambers, that's what that is at the top right corner, is used to give like high doses of oxygen, like pure oxygen, which is supposed to help treat the infection. Maggot therapy is also a thing where maggots will only like eat dead tissue and leave like healthy tissue alone, so that's a way to like remove dead tissue. And then radiation therapy. So incidence prevalence, like I said, high wartime incidents. There's just some stats about like World War I and how it's kind of gone down due to our increased knowledge of the disease and how to treat it. U.S. population, the density of the Clostridia species in soil kind of contributes to whether post-traumatic cases happen, like the prevalence of those happening. There's approximately 3,000 cases a year, so it's still it's like around. It's not something that's been eradicated or anything like that. Like, it's still pretty prominent in the U.S. And then international, after like natural disasters and stuff, there's high incidence. Like 2004, 2008, after the Indonesia tsunami and the Wenchuan earthquake, there was like people floating around in contaminated water, people with like open wounds trying to walk around, look for help, getting infected. So there's high cases there. And then April 2000 to June 2000, there was a bunch of heroin users in Scotland, Ireland, and England using, I'm assuming, dirty needles, who got infections, and there was a 90% mortality rate in those people because with the infection they contracted gangrene, and a lot of them died. Liposuction complications in Germany led to gangrene, and there was a lot of deaths there as well. So these are my sources. If you guys have any questions, feel free to ask me during class in the panel. Thank you guys for watching. Have a great night.